Welcome to This Explainer. Look, let's just dive right into something we've literally all experienced at one point or another, and frankly, something that can cause a really surprising amount of anxiety. You're looking in the mirror, you're brushing your teeth, and suddenly, you spot it. A strange red or white mark on your gums, and immediately your mind just starts racing, right? We have all been there. Finding an unexplained spot in your mouth is incredibly nerve-wracking. But hey, before you completely spiral into one of those internet search panics, just take a deep breath. Today, we're going to break down exactly what you're looking at and give you the tools to understand your oral health with total confidence.
So that brings us to the ultimate question, doesn't it? Is that just a normal, everyday canker sore? I mean, most of the time, the answer is a resounding yes. We accidentally bite our cheeks, we eat a piece of pizza that's way too hot, and boom, we get a sore. But how do you actually know for sure? How do you distinguish between a totally harmless annoyance and something that might actually require medical attention? Well, our goal today is to decode your gum health. By the time we wrap up this explainer, you're going to know exactly what to look for, what to feel for, and exactly when it's time to call a professional.
Okay, here's our quick roadmap for today. First up, the hidden oral danger. Second, who is at risk. Third, early warning signs. Fourth, how to check yourself. And finally, number 5, the next steps. Let's jump right in.
All right, Section 1, the hidden oral danger.
Specifically, we're talking about gingival cancer. Now, this is a very specific type of oral cancer that develops directly on the gums themselves. And what's really interesting, well, actually kind of tricky about this, is that when most people think of oral cancer, they immediately think of the tongue. And, they wouldn't be wrong. Tongue cancer is actually the most common oral cancer. But gingival cancer, or gum cancer, is this hidden danger that often just flies totally under the radar. Why? Because it disguises itself as a common mouth ulcer. It most frequently pops up around the gums, way in the back by your molars, or right behind your lower front teeth. And because it hides in these areas, it is just incredibly easy to write it off as a stubborn, everyday sore.
But listen, before we go even one step further, I really want you to consider this number, 1%. I want to reassure you right out of the gate here, out of all the cancers that can develop in the entire human body, oral cancers make up only about 1%. That is tiny. It's rare. So there's absolutely no need to panic. We aren't learning about this today to get scared, right? We're learning about this so we can be smart, proactive, and truly aware of our own bodies.
Moving right along to Section 2. Who is at risk?
So a lot of these risk factors might seem like your usual suspects for general health issues, but they have a very specific, targeted impact on your gums. At the top of the list, we've got smoking habits and excessive alcohol consumption. Then we have mechanical issues, things like ill-fitting dentures or old, sharp fillings. Poor oral hygiene is on there too, like leaving severe periodontal disease completely untreated. And demographically speaking, this primarily affects folks who are 50 and older. However, and this is a really absolutely crucial point, younger people are not totally immune to this. Dental professionals absolutely do see this in younger patients, so honestly, no matter your age, this is highly relevant information to keep in your back pocket.
Now, I really want to isolate the biggest trigger here. Smoking is, without a doubt, the absolute highest risk factor. The carcinogenic substances found in tobacco have this direct, undeniable impact on the super delicate tissues inside your mouth. If you are looking for the number one single best thing you can do to protect yourself from oral cancers, cutting out tobacco is the undisputed answer. And this next point brilliantly illustrates a really surprising mechanical process. It's almost like a domino effect. Step 1, ill-fitting dentures or maybe a sharp filling constantly rubs against your gums. Step 2, that constant repetitive rubbing causes chronic inflammation. Step 3, over time, that chronic, never-ending inflammation can actually mutate and transform into cancer. We usually think of cancer as something purely chemical or genetic, right? But here, we're actually seeing a mechanical danger. Basically, if you have something in your mouth that is constantly poking, scratching, or rubbing your gums day in and day out, it's creating a state of chronic inflammation. And that is highly dangerous if you just ignore it.
Okay, on to Section 3, early warning signs. Let's talk about what to look for.
Let's establish a clear visual baseline. Think about your normal, everyday canker sore. A normal sore heals naturally in about 1 to 2 weeks, and ironically enough, it usually hurts a lot, like it's painful. But contrast that with potential gum cancer. The golden rule you need to remember here is time. If a sore persists beyond 2 weeks without changing or healing up, that is your primary red flag. Secondly, and honestly this is super sneaky, early gum cancer is often completely painless. You might literally not feel it at all. Visually, instead of a standard ulcer, it might look kind of like a mottled mix of red and white, almost like a patchy area sitting right on the gums.
But, it's not just about sores.
Let's look at a few other alarming symptoms. Persistent swelling or maybe bleeding in one specific spot that just won't seem to resolve itself. Sudden, totally unexplained, loose teeth when you haven't even had a recent injury. And look at this third one, dentures suddenly failing to fit. Think about the logic behind that for a second. Gums do not typically change their shape rapidly overnight. If yesterday your dentures fit perfectly and today they simply won't sit right because the gum shape is physically altered, that means something underneath is pushing them up. Finally, any unexplained pain or weird numbness that you can't tie to a specific cause, that's a major clue that definitely warrants some investigation.
Section 4. How to check yourself. Let's build a proactive routine.
I want you to basically become a detective in your own mouth. And here is your simple 3-step checklist. Step 1, look at the color. You're checking under your tongue, up on the roof of your mouth, and along your gums for any of those mottled red or white patches we just talked about. Step 2, feel for stiffness or hard lumps. Seriously, wash your hands and actually touch your gums. A normal mouth is relatively soft and squishy. If you feel a hard, stiff, almost marble-like lump, pay attention to that. Step 3, check for left to right symmetry. This is a massive clue. Human bodies are generally pretty symmetrical. So if the left side of your gums is flat and totally normal, but the right side has this sudden, weird swelling, that asymmetry is a big red flag.
So when exactly should you be doing this? The absolute best time is in the morning, right after you brush your teeth or scrape your tongue. I mean, you're already looking right in the mirror. You're already focused on your mouth anyway. By integrating this super quick, like 30-second visual inspection into your daily hygiene routine, you become incredibly familiar with what your personal normal looks like. And because you know your normal inside and out, you will instantly catch any subtle changes if they happen over time.
And that brings us to Section 5, the next steps. Here is your action plan.
First up, I want you to listen to this really powerful reminder from our medical sources. Quote, "The internet has lots of free information, but that information won't take responsibility for you. Don't carry that anxiety alone." Look, it is so incredibly tempting to fall down a massive rabbit hole of internet searches, trying to diagnose yourself at 2 a.m., working yourself into a state of sheer panic. But the internet cannot examine you. It can't run physical tests. Please do not burden yourself with the heavy anxiety of self-diagnosis.
Instead, follow this really clear action plan. Just do not self-diagnose. If you see something weird, visit your local dentist immediately. Dentists are highly trained professionals. They look at mouths all day, every single day. They know exactly how to distinguish a stubborn sore from a genuine threat. And hey, if you go in and they're even slightly unsure, they'll simply monitor it for a week or two, or maybe refer you to a specialist. And here's by far the most reassuring point. Early detection means minimal damage. If it actually turns out to be cancer, catching it at this super early stage often means a highly successful, minimally invasive treatment. They simply remove the small affected area and you just go right on with your life. Catching it early is a total game changer.
And here's something you might not even realize is happening right under your nose. Regular 3 to 4 month dental checkups always include an oral cancer screening. When your dentist is, poking around, feeling your jawline and looking way at the back of your throat, they aren't just looking for cavities. They are actively checking for these hidden, life-threatening dangers every single time you sit in that chair. Preventative care is quite literally saving lives behind the scenes.
Which brings us to our final thought for today, and it leaves us with one pretty critical question for you. When was the last time your dentist really checked your gums? If it's been a while, or maybe if you've got a sore right now that just isn't playing by that 2-week rule we talked about, let this be the nudge you need. Don't carry the anxiety all by yourself. Make the appointment, take control of your health, and go get that peace of mind. Thank you so much for joining me on this explainer, and stay proactive out there.